In this short video analysis, I'll be discussing the technical model of the back squat. This will be a more generalised and fairly basic analysis, simply because there are so many things that could be included in the discussion. I don't believe that one could fully analyse a back squat in a 5-minute time window, so forgive me if there's anything that I may miss out, but please do comment if you feel something vital or important should be included. Here we can see an athlete fully extended at the top of the squat movement from a lateral view. The hoodie he's wearing makes it slightly more difficult to see where the bar is positioned, but in the most commonly seen high bar position during the back squat, it should rest close to the C7 vertebrae. An often overlooked fact is gaze. Where should the athlete be looking when performing a squat? Donnelly et al. Showed that a downward gaze increases trunk flexion by 4.5 degrees and hip flexion by approximately 8 degrees compared with a straight line or upward gaze. I've pasted the online URL of this study in the video in case anybody wants to have a look. As you can see, the athlete has a straight ahead gaze when at the bottom of the squat, which helps to keep his back lumbar extension. When setting up for the squat movement, feet should generally be placed slightly wider than hip width, with toes turned out at an acute angle. Not everybody will have the same foot positioning while squatting, and this will be discussed in a little bit more detail towards the end of the discussion. When breathing during squatting, it's important to breathe in deeply at the top of the movement. This stiffens the upper body and the torso becomes more rigid by creating intra-abdominal pressure, which provides additional support to help stabilize your spine and brace your core. During the concentric or upward movement of the squat, the athlete should be breathing out. Holding your breath for the entirety of the lift could result in the athlete passing out. The lift should initiate with a backward movement of the hips, shortly followed by flexion at the knee. However, sitting back as far as possible will limit the depth to which an athlete can squat and potentially cause the athlete to fall over due to loss of balance. In this slowed down footage, the athlete demonstrates simultaneous hip and knee flexion, with neither clearly beginning before the other. This movement appears absolutely fine, but as a coach, my preference would be to see a small amount of hip flexion before knee flexion occurs. In this freeze frame, the green line represents a good upright torso angle, while the orange and red lines represent a progressively worsening torso angle. It is important the athlete keeps their chest up, with a strong, flat back to prevent any extra and unnecessary forces being exerted on the spine. Poor stability and strength in the torso could result in injury, especially if excessive spinal flexion was allowed to continuously occur without being fixed. Movement of the knees are a vital component of all squat variations, not just the back squat. Knee valgus is a term used to describe an inward movement of the knees from an anterior viewpoint. As you can see, our slow motion footage shows the anterior view of an athlete performing a back squat. The green lines represent the optimal path of the knees tracking over the toes. The red line represents inward movement of the knees or knee valgus. Consistent knee valgus can increase the risk of injuries, such as knee osteoarthritis and cruciate ligament damage. Because good knee function is so vital to almost every sporting movement and everyday life, it is vital that correct knee alignment is maintained throughout the back squat movement. So here we will see slow motion footage of an athlete squatting down to their max depth. At the bottom of the squat, we can see that the tops of their thighs are almost parallel to the ground, as shown by the orange line. Most of the time when training, the green line should be the target depth. There are many reasons why an athlete may not be able to move into the deep squat position, and many of these issues preventing deep squat can be resolved. However, it is important to understand that some athletes may be anatomically limited to such an extent that they're just not physically capable of ever achieving optimal squat depth. Here, we can see a comparison of two femurs and two pelvic girdles. From these pictures, it should be clear that people can be built very differently, and not every athlete will be able to move in the same way. It is important that each individual moves in their own individualized and optimal movement pattern.